I just want to clarify something you said in your introduction, Secretary of State. You said the proportion of corona deaths in care homes is around a sixth of the total. I mean, in week 16, which I think is ending April the 17th, care home deaths were actually 23% of the official COVID deaths. And of total deaths, not just COVID, closer to a third. Are you saying that the number of people who've died in care homes during this crisis is around in line with the number of deaths you would normally see in any other year?
No, I'm absolutely not saying that latter point. What I was saying very clearly is that in the statistics that have been published so far, the number of deaths from coronavirus in care homes is around a sixth in total. But of course, the breakdown of the statistics, exactly as you say, shows that proportion is changing, and we've got to. So I was putting it in the broad context, but also saying that it is an absolute focus of ours because it's an area which you've highlighted many times in the past, and an area where we've got a huge amount of focus. Thanks. Ben Kentish from LBC.
Can I just have a follow-up, please?
Yes, of course, Nick.
Sorry, I'm so sorry.
No problem.
A lot of people have died in care homes. I've seen it with my own eyes. And you knew, and your department knew, that this was a high-risk area. You've issued guidance to care homes repeatedly over the last few months. And yet, PPE was inadequate. Tests, for the most part, were few and far between. But yet the deaths in care homes seem to take you and your department by surprise. I wonder, and this isn't meant to be a clever catch-you-out question at all, but I wonder if you will take this opportunity to apologise to those families of loved ones who died in care homes because the government didn't properly protect them.
That's the thing is, Nick. I think that's unreasonable as a question, actually. And I know you care an awful lot about this, but from the start, we knew that there was a very significant challenge with care homes, not least because of the frailty of the residents, and the enormous work that's gone on within government, Public Health England and local authorities and the CQC to monitor this from the start. It has been more difficult to get data flowing, and I'm very glad we're able to do that now on a daily basis instead of a weekly basis as before. And making sure that care homes have the support they need has been absolutely at front of mind right from the start. In fact, I can remember in one of the very early discussions about coronavirus in January, having a discussion about, because one of the first things we knew about this virus was that it had a very strong age profile, as in it was much more dangerous for older people, that immediately drew our attention to the fact that there was a big challenge in care homes, especially because people are more frail and therefore they're more at risk. So it's something that we've focused on right from the start, and something that's been a huge challenge throughout, and we're constantly learning from what happens and trying to improve the way that we support people across the care sector. Ben Kentish from LBC.
Secretary of State, why didn't you bring in tests earlier? It just seems odd that it took a while for tests to come through. Why didn't you, if you knew the risks, and as you just clearly said, why did it take you so long to give the sector what it was crying out for, and that was tests?
Well, we have been testing in care homes right from the start and throughout the crisis. So that's one of the things in your question that I dispute. And I know the passion that you have for this subject, but it is really important for us to explain what's been going on, and we've been testing right from the start. John.
So yeah, it's important to understand that from the word go, Public Health England's been investigating any outbreaks of coronavirus in care homes, and the approach there would be to test a limited number. When test capacity was limited, we're talking about beginning of April, test capacity was limited to test a number of index cases to clarify that it was an outbreak of coronavirus. Then the whole care home would be treated as if the symptomatic cases were all coronavirus, and various measures were put in place, and no doubt many lives saved as a result. obviously now we have more testing and we have more knowledge about the way the virus spreads in care homes. We're able to adapt that and will be even more effective. But it'd be wrong to say that testing was not available and not used. And it would also be wrong to say that nothing was done about these outbreaks. A great deal was done, but we're confident we can be more effective now than in the past. And the issue of care homes is an international one. Every country in Europe has had a significant problem with a large proportion of the deaths from coronavirus occurring in the care home sector. We are no different in that respect. And the care home sector is a highly distributed system. It's intrinsically difficult to deliver services to that sector, but nevertheless, a huge effort has been made in collaboration with organisations like the Care Quality Commission and also local government. So a lot has been done. We all want to do more, and we are, certainly with testing, we're going to be able to do a lot more with this additional capacity that Secretary of State described.